Hello, friends. Let me introduce you myself. I am Dr. Anand, Ayurvedic physician and consultant. I have founded Kayakalpa Ayurveda Clinic Mauritius in 2010. I have been practicing in the field of Ayurveda since 2005, and I have done several radio talk shows, television programs on awareness of Ayurveda. I've been lecturing also. I'm an entrepreneur and a visionary for Ayurveda. Say that, it was always coming in my mind because normally as a clinician, we consult our patients, we treat them. But the awareness of Ayurveda, the lack of awareness also I have felt in the society. There are a lot of question marks. Some people also go to an extent and call Ayurveda as a pseudoscience, which is very, very misleading. And it's my duty as an Ayurvedic physician, and I'm sure many Ayurvedic physicians must be listening to this, apart from the general public. And it's our duty as an Ayurvedic physician and consultant that we should make people aware about Ayurveda. What is Ayurveda actually? Because many a time people think that Ayurveda may be a medicine, Ayurveda may be something like a cosmetic, because you say Ayurveda cosmetic. They are misusing the word Ayurveda actually. Nobody knows about exactly what is Ayurveda. So let me tell you something very clearly that Ayurveda is an ancient medical science and it has two objectives. One is to prevent the health of a healthy, and second thing is to treat the patients. Sometimes, also have seen through my clinical practice that, either wellness is regarded as Ayurveda. Now we are talking about that, okay, through Ayurveda you can be well, but you cannot be treated. But this is also wrong. We are going to the extremes. Either we are thinking Ayurveda only as wellness, or sometimes we have a debate on treatments also. So let me clarify. This is very, very important for all of you to understand that it's a complete science in itself. And I think you might have heard about the meaning of Ayurveda. Everybody talks about Ayur and Veda. Ayu means your life and Veda means knowledge. But let me elaborate you. It's a proper encyclopedia. It's a manual because how you maintain your body, maintaining body not only in terms of physical aspect like your physical well-being and your external health, but also internal health. And that's why, when we speak about health, we say that it's a state of complete physical, mental, social, spiritual, and this is all the well-being together is the holistic approach, and that is real health. It's not only that you are physically fit and you're too much stressed with day-to-day things. So to create a great balance between body, mind, and soul. That is the objective of Ayurveda. And I personally tell you through my clinical practice, I have treated several patients, which have been referred, which were not treated elsewhere. So it gives us a confidence as a physician that yes, we can treat several ailments which are otherwise they were difficult to treat. So let me tell you the excelling part of Ayurveda. I'm not criticizing any other medical science or anything. First of all, I am a big critic of being Ayurveda called as alternative medicine. Can you put a logic? A science which has been more than 5,000 years old and you call it as an alternative medicine? We are not here to debate. There are some pseudo intellects who can call Ayurveda as a pseudoscience, but actually everything which is existing, whether it's Ayurveda, yoga, Siddha medicine, Chinese traditional medicine, or Western traditional medicines, all these traditional practices have been there for ages. So you cannot just discard them like anything. I can vouch on that there are so many patients who have been using various forms of medicines and they are getting better. As I am an Ayurvedic practitioner, I am practicing Ayurveda. But now let me clear one thing, that yes, there is a need of integration. That's what we call the future of medicine. So there should be no gap. There should be no, controversy. Where is the controversy? See, we all are having the same as a doctor. I call all the doctors, Let's open a platform, discuss among each other, that where is the debate? Why we are debating each other and calling that, okay, this is that. See, for example, let me quote, okay, let me start with my own system of medicine, Ayurveda. Ayurvedic system of medicine, when we talk about, is also limited somewhere. Say, for example, if I get an accident, what I will do, where I will go. I have a severe accident, definitely I need medical emergency care. So there definitely for this fixing of my complete body or whatever it happens, God forbid, anybody, it can happen to anybody. So we need emergency care services. So similarly, if you have a chronic condition, say for example, let's take another example, antibiotics. Many people, need antibiotic. When you suffer from a severe infection, you are having high grade fever, it is clear that there is an infection somewhere. You need to take antibiotic to kill the bacteria, But in case if the repeated infections are happening in the body, so why not we come and explain the patients? There comes the importance of alternative, what you call alternative. I would not call this alternative actually. The various other forms of medicines. Say for example, let's take my discipline where I am practicing Ayurveda. So Ayurveda is highly efficient in boosting your immune system so that in future you may not need antibiotics. See, everybody knows antibiotic is good, it's killing bacteria, but at the same time it kills healthy bacteria in the gut. It causes a lot of gastrointestinal disturbances. So at the same time, if person is taking antibiotic, he's also prescribed some Ayurvedic herbs. So will it not be beneficial? I ask this question. Anybody, it's a logic. Will it not be beneficial? It will be. So this is what we need to understand. We actually are filling gaps of each other. We are not here to fight. We are not here to create any controversy. So this is my short introduction, just short talk, I've been addressing. This is my introductory channel, the first episode, where I want to tell people that I will elaborate this in future videos. Definitely, please be tuned on those things. But I want to just to tell you that there is no confusion. I am going to clear out all the confusion. Many a time patient comes and tell me also, Dr. Anand, we don't know where to go. So what to do? And at times, some of the other system of medicine, pseudo intellects or not informed, they criticize other forms of medicine. से होम्योपैथी आयुर्वेदा नो ये काम नहीं करते, ये सब बेकार है. ऐसा नहीं है. Everything which is existing has its importance, but we need to understand that. And for this very purpose, I have opened my YouTube channel. I found this information nowhere in the world. Nobody is sharing about, nobody is clearing your doubts. You have doubts, you as an innocent people who are suffering from health, you have questions, You have various questions. I'm going to answer your question and let's open a common platform, about this. Because we all are here just to provide a better solution, a better word, which is more healthy, And say we are saying we are facing many challenges. Health challenges are there in front of us. So why not we unite together and create a kind of conducive environment, a positive environment, and we work together for the health of people, And it is my humble beginning. I hope you will like my channel and you will like to subscribe it. You will like to view more of my thoughts. I hope so. And if you have any queries, please do write in comment section. I will be very glad to answer your questions. And even if you are doctors are also invited to do the same. And as I told you, my ambition is to bridge the gap and create an integration of all forms of medicine so that we can together work for humanity and reduce the suffering of common man. Thank you.